Hello everyone, and welcome to our presentation on polymyositis. Polymyositis, also shortened to PM, is a chronic inflammatory myopathy characterized by the muscle inflammation and weakness. Other potential names or classifications include idiopathic inflammatory myopathy and myositis. It falls under the category of autoimmune myopathies, which are closely related conditions such as dermatomyositis and inclusion body myositis. Polymyositis is considered a rare disease with an estimated prevalence of 1 to 10 cases per million people per year. It is more common in adults between the ages of 30 and 60, with a higher prevalence in females. The exact cause remains unknown, but it is believed to result from an abnormal immune response that attacks skeletal muscles, leading to chronic inflammation and muscle fiber degeneration.
Normally, the cells of the immune system are ready to spot and destroy anything foreign that could cause the body harm. Cells in the body have a set of protein molecules that sit on the surface of their cell membrane, MHC for short. Normally, the immune system recognizes these molecules from within the cell as harmless, and this is known as self-antigens, and there is no response. However, with this disease, the immune system mistakenly attacks muscle cells, thinking they are harmful. This happens when certain immune cells, like T cells, recognize autoantigens as threats. These immune cells then release signals that cause inflammation and directly damage muscle cells. Over time, this repeated immune attack leads to apoptosis, which is programmed cell death of the muscle cells.
When looking at diagnosis for PM, specific muscle characteristics can be identified, such as antibodies, muscle enzymes, and electromyography. One specific antibody that is observed is the anti-Jo1. Anti-Jo1 antibody is produced by the immune system that mistakenly targets the body's tissues, such as muscle fibers. Increased levels could indicate PM. Elevated muscle enzymes, such as atolase and creatine kinase, indicate muscle damage, which could be an indication of PM. Electromyography, or EMG, could be used to measure the responsiveness of muscles to see if they are damaged. Finally, taking a muscle biopsy, as shown on the right, can indicate regions within the muscle fibers that are damaged or destroyed. Polymyositis primarily affects the muscular system, leading to progressive proximal muscle weakness, especially in the shoulders, upper arms, thighs, and hips. Additionally, PM individuals can also experience risk of contracting musculoskeletal diseases such as fibrosis and osteoporosis. PM individuals can also experience a dysregulated immune system, which can cause chronic inflammation due to the immune system attacking muscle fibers. Within the respiratory system, weakening of the diaphragm and intercostal muscles can lead to breathing difficulties, making individuals more prone to pneumonia or respiratory failure in severe cases. Inside the cardiovascular system, increased risk of heart disease due to inflammation and muscle weakness. Some studies indicate a larger likelihood of myocarditis and arrhythmias. Within the skeletal system, there is reduced mobility and joint stiffness due to the muscle atrophy and fibrosis, potentially increasing the risk of osteoporosis and fractures. In the gastrointestinal system, involvement of the esophageal muscles can lead to swallowing difficulties such as dysphagia, which can increase the risk of aspiration pneumonia and malnutrition. In the nervous system, some individuals may experience mild neuropathic symptoms, although polymyositis primarily affects the muscles rather than the nerves. Gastrointestinal system diseases such as dysphagia, GERD, and malnutrition can arise in individuals with PM. Psychological issues can be increased with patients with PM, such as depression, social isolation, which is caused by a decreased ability to move around, chronic pain caused by the atrophy of muscle fibers, and fatigue that comes from the mitochondrial dysfunction. Within the muscle fibers, PM can cause increased production of antibodies, and the T cells mistakenly recognize muscle cells as foreign bodies, which causes muscles to atrophy or die. PM individuals can also experience respiratory complications, which can cause breathing difficulties, reduce lung function, and in extreme cases can cause complete respiratory failure. People with PM can also experience a loss of independence, with specific motor problems such as standing up from a chair, lifting their arms, walking up the stairs, and combing their hair. PM causes cardiovascular issues. Inflammation can affect the heart muscle and increase the risk of arrhythmias and heart failure. Peripheral vascular issues like rhomboids phenomenon can also develop. Finally, PM causes chronic pain and fatigue due to the prolonged muscle inflammation, oxidative stress, and immune system overactivity, leading to reduced quality of life and disability. In the early phase of PM, there is an onset of muscle weakness in specific areas of the body, which can cause individuals to become fatigued. Individuals affected by PM have trouble with motor activities such as walking up the stairs, lifting objects, and standing up from a seated position. Individuals can receive an MRI and EEG to show muscle atrophy in specific body regions with muscle weakness or fatigue. Individuals within the active phase of PM have an increase in inflammation and worsening muscle weakness or symptoms. Individuals can receive medical interventions such as corticosteroids, which can reduce inflammation, immunosuppressants, which can reduce the immune system response, or physical therapy to help reduce the atrophy of muscles. Chronic or late phase of the disease causes many physiological disruptions within the body, such as muscle atrophy, fibrosis, permanent muscle damage, or in severe cases, potential disability. There is no cure for polymyositis, but many treatments such as corticosteroids, immune suppressants, IVIG, and physical therapy can help reduce severe symptoms of the disease and allow patients to live a relatively normal, active life. Without treatment for PM, individual symptoms will progressively get worse.
Many people wonder whether exercise is beneficial or harmful for individuals with polymyositis. The answer depends on several factors, including the type, intensity, and timing of exercise. When done correctly, exercise can support muscle function, reduce complications, and improve overall health. However, if overdone or done improperly, especially during disease flare-ups, it can worsen muscle damage and cause inflammation. So what are some key benefits of exercise for individuals with polymyositis? Number 1, muscle adaptation and strengthening. Exercise plays a crucial role in preserving muscle function and preventing deterioration. It helps reduce muscle atrophy, improve strength, and prevent contractures, permanent muscle tightening that can limit mobility over time. Resistance training is particularly beneficial as it promotes muscle hypertrophy and counteracts muscle loss caused by inflammation. Additionally, exercise activates satellite cells, which can aid in muscle fiber repair and reduce degeneration. Low-impact resistance training is especially effective in stimulating satellite cells, which are essential for muscle regeneration and repair. Regular, controlled movements also prevents contractures, helping to maintain mobility and overall function. Number 2, anti-inflammatory effects. Physical activity plays a crucial role in managing inflammation, especially for individuals with polymyositis or short PM. Regular exercise helps regulate cytokine production, which in turn reduces chronic inflammation that can lead to muscle damage. Additionally, exercise enhances blood circulation, helping to remove autoantigens, substances that trigger immune responses, while also reducing immune-mediated muscle apoptosis, or programmed cell death. By modulating the immune system, exercise prevents excessive muscle destruction caused by PM. Another important benefit is the reduction of oxidative stress. Since oxidative stress is a key contributor to chronic inflammation, exercise helps to lower its impact, leading to overall better muscle health and function. Number 3, cardiovascular improvements. Exercise also provides significant cardiovascular benefits for individuals with PM. One of the key effects is an increase in mitochondrial biogenesis, which means the body produces more mitochondria, the energy powerhouse of the cells, leading to improved ATP production, reducing oxidative stress, and combating muscle fatigue. Furthermore, exercise helps reduce muscle apoptosis, which preserves muscle integrity and function. Since PM has been linked to an increased risk of cardiovascular diseases due to chronic inflammation affecting the blood vessels and heart muscles, regular physical activity is essential. Engaging in consistent aerobic exercises improves circulation, lowers blood pressure, and enhances endothelial function, the ability of blood vessels to properly expand and contract. This reduces the risk of heart-related complications and improves overall heart health. And finally, improving cardiovascular endurance helps combat fatigue, a common symptom of PM. Regular movement boosts stamina, allowing individuals with PM to maintain a better quality of life.
Neuromuscular benefits for physical activity show that strength training improves motor unit recruitment, leading to better movement efficiency and a reduced risk to falling, as well as maintains joint mobility and flexibility, preventing contractures and stiffness. By improving joint mobility and reducing stiffness, exercise helps prevent complications associated with immobility. Long-term periods of immobility can lead to joint contractures, stiffness, and a reduced range of motion. Gentle stretching and mobility exercises help maintain flexibility and joint function. Neuromuscular training, such as balance exercises, enhances coordination, which is important for preventing falls and injuries. The psychological benefits have shown that exercise has been shown to reduce fatigue, depression, and anxiety, which are common in individuals managing chronic illnesses like polymyositis. Living with polymyositis can lead to mental health challenges, including depression and anxiety, due to the physical limitations and chronic fatigue. Exercise releases endorphins and serotonin, which help improve mood and well-being. Regular physical activity has also been linked to better sleep quality, which can further reduce fatigue and improve cognitive functions. Mitochondrial function benefits with physical activity is that exercise enhances the efficiency of the mitochondria in muscle cells, boosting energy production and reducing fatigue. Mitochondria are responsible for producing ATP in muscle cells, and polymyositis can lead to mitochondrial dysfunction, making it harder for muscles to generate energy efficiently. Regular exercises increases the mitochondrial biogenesis and improves energy efficiency, helping to reduce muscle fatigue. Important considerations with exercise is that while exercise offers numerous benefits, it is always important to approach it carefully.
Evidence-based benefits of exercise for PM. Exercise plays a crucial role in managing PM, and research supports its safety and effectiveness in improving patient outcomes. According to Lemon-Munters et al. 2019, endurance exercise has been shown to improve muscle function without increasing disease activity. Similarly, Galactus 2018 highlights that supervised physical therapy programs can enhance patient outcomes while minimizing risks. Resistance training is also beneficial. D'Souza and D'Assis 2020 found that low to moderate intensity resistance training provides anti-inflammatory effects and helps maintain muscle integrity. Additionally, Lay et al. 2016 reported that aerobic exercise can reduce cardiovascular risks in PM patients. One of the most comprehensive studies, Weisinger et al. 2021, found that a 12-week combined resistance and aerobic training program significantly improved mobility, strength, and reduced disease activity markers. Overall, these findings demonstrate that structured exercise programs are not only safe but also essential for improving muscle function, cardiovascular health, and overall disease management in PM.
Some safety considerations to account for if you're dealing with polymyositis would be to focus on low to moderate intensity resistance and aerobic training, such as a brisk walk and weightlifting instead of high intensity exercise. Aquatic therapy is a great alternative because of the reduced strain on joints while also improving on range of motion. Stretching and flexibility exercises help prevent stiffness. Supervised programs with gradual progressions that are prescribed by a physiotherapist. And during exercise, the patients with polymyositis should monitor their fatigue levels and adjust the intensity accordingly. Some personal risks that may arise when exercising with polymyositis could be overexertion during exercise, which can lead to an increase in the muscle damage and muscle inflammation. Excessive fatigue may worsen symptoms if sufficient rest periods aren't taken between sets of physical activity. Cardiovascular risks should be monitored in patients with pre-existing conditions such as higher blood pressure and obesity. Potential respiratory complications in severe cases of polymyositis require very close supervision when participating in exercise.